difference between type 1 and type 2 diabetes. Diabetes can cause serious long-term health problems, if left untreated or not treated properly. Ad choice advertising in red invented by Teeds. Ad choice advertising in red invented by Teeds. The symptoms of diabetes type 2 are listed by the NHS as peeing more than usual, particularly at night, feeling thirsty all the time, feeling very tired, losing weight without trying to, itching around your penis or vagina, or repeatedly getting thrush, cuts or wounds taking longer to heal, and blurred vision. The foods you choose to eat in your daily diet can make a big difference, whether you are living with diabetes or not. Bupa states a low-GI diet is good to follow if you have diabetes. GI stands for glycemic index of a food, the measurement of how quickly the glucose in it is released into your bloodstream after eating. On its website it says this is because eating slowly absorbed carbohydrates, instead of quickly absorbed carbohydrates, can help keep your blood glucose levels even. Some studies also suggest that a low-GI, high-fiber diet may help to reduce your risk of type 2 diabetes. And in general, many low-GI foods that are rich in fiber are an important part of a healthy, balanced diet. Its tips for a low-GI diet include 5 food swaps. The first is choosing basmati rice instead of white rice. You should also swap a baked or mashed potato for a sweet potato. And instead of white and wholemeal bread, choose granary or rye bread. French fries can be swapped for wholemeal pasta or noodles. And finally, for breakfast, you can enjoy porridge or whole grain breakfast cereals instead of cornflakes or white toast. Heavy alcohol consumption can increase blood sugar, and one alcoholic drink in particular should be avoided. Alcohol can dangerously increase blood sugar and lead to liver toxicity. Research published in Annals of Internal Medicine found there was a 43% increased incidence of diabetes associated with heavy consumption of alcohol, which was defined as 3 or more drinks per day. According to nutritionist Dr. Josh Axe on his website, beer is especially high in carbohydrates and should be avoided. The site also adds that sweet liquors have the same effect. Starchy foods, such as potatoes, meat, fish, eggs, pulses, beans and nuts are recommended. Fruit and vegetables are also a good choice. Everyone should eat at least 5 portions a day, as recommended by health guidelines. But a certain type of fruit should be avoided, according to nutritionists at Healthline. While fruit is a great source of several important vitamins and minerals, including vitamin C and potassium, dried fruit should be avoided. The site explains, when fruit is dried, the process results in a loss of water that leads to even higher concentrations of these nutrients. Unfortunately, its sugar content becomes more concentrated as well. 1 cup of grapes contains 27 grams of carbs, including 1 gram of fiber. By contrast, 1 cup of raisins contains 115 grams of carbs, 5 of which come from fiber. Therefore, raisins contain more than 3 times as many carbs as grapes do. Other types of dried fruit are similarly higher in carbs when compared to fresh fruit. The longer you have diabetes, and the less controlled your blood sugar, the higher the risk of complications. The NHS outlines 6 complications of type 2 diabetes.